So we're going to start off talking about migraines, and we're going to look at what a migraine actually is. Some people have some confusion on if they do experience migraines or if it's a different type of headache. What we'll do is look at what the characteristics are of a typical migraine, also some of the things that will cause or trigger migraines, and then we'll lead into some of the treatment that we use here in the office to help people that have migraines. So starting off with the features that typically are associated with migraines. Now, these are not things that have to happen. Migraines can show up in a lot of different ways. These are the most common features that we see with migraine headaches. So the top of the list here, which is occipital or frontal, that is the location of the headache itself. So by occipital, this is the back of your skull where the neck meets the skull. That's called your occipital area. A lot of times people have these headaches that start back in that area and then they move to the front or the frontal. We see these headaches showing up typically on one side or the other. Sometimes they'll feel like they're behind the eye or over the eye, but they typically don't show up on both sides. Not to say that they can, but they typically don't. The pain intensity on a scale of 0 to 10 can range anywhere from a 3 to a 10. Typically the 3 is when things are starting. 10, you can be as much as a 10 out of 10 when you're actually experiencing the headache full blown. Migraines are typically activated or aggravated by an activity. So this would be things like activities of daily living, such as going about anything from work to sports, anything that you typically do throughout the day. This would aggravate the migraine. And beyond aggravating it, typically prohibits an activity. So let's say, for example, you have a tension headache, but you really want to go golfing on Saturday. Typically, you're going to fight through that tension headache to go out and go golfing. But if you've got a migraine, you're typically not going to go out and golf or really do much of anything for that matter. So it prohibits that activity. Autonomic features, these are things that show up that you don't see with other headaches. They can be everything from nausea, dizziness, some type of sweating that comes along with this. So these are other features that you might find associated with a migraine that you wouldn't typically find with a tension headache. And an aura. Auras are basically flashing lights. They can show up in a lot of different ways. They can show up as kind of a tunnel vision or as little blots that show up in your field of vision. This is something that you don't have to have, but it is pretty common with certain migraines. So the interesting thing about migraines is they don't show up typically when you're in the middle of a stressful situation. They show up afterwards. So this is what people typically experience when they have headaches on the weekend. They may have had a stressful week, and then they're calming down throughout the say the evening on Friday. Then the next morning they wake up and they're having a migraine. These stresses can be a number of different things. They can be emotional stresses. This is what we typically think of. This is stress associated, say, with your job or relationship. They can also be dietary stresses. For example, if you have a lot of sugar, this can cause some people to trigger a migraine. There are certain other things such as chocolate, cheese, and certain other foods like caffeine, either having too much or not having enough. If someone's coming off of a caffeine withdrawal, you can see a trigger for the migraine. Environmental stress. Now this could be something, for example, if you are painting, if you are exposed to some type of toxic chemicals, these can also be triggers for a migraine. So as chiropractors, one of the things that we see that migraines are typically, or at least the ones that come into our office, are typically associated with problems in the neck. These are people that usually have tried everything else, and they may get some relief. They may have tried certain medications like Imitrex or amitriptyline and get temporary relief, but they don't like the side effects associated with the medication. So what we do is we typically look at a neck and see how the person's neck looks. Now we'll look at the left-hand side, which this is what I would call an abnormal neck. On the right-hand side, this is a normal neck. So the difference between those two, and I'm going to put up these two ovals here to show you, your normal neck should have a nice curve that follows this oval. Now as you can see, these are the back of the vertebra, and they follow nicely along this curve here. If you look at this neck right here, instead of going out as it should and having that nice C shape as we see on the right hand side here, we see this bending backwards and back and forward. This puts undue stress on the neck, which can trigger headaches and cause migraines to start. Now we also look at the neck from the front, and what we're looking at here on the left hand side, this is the abnormal neck again, drawing a straight line up from the top of the shoulders, and you can see this neck is jutting off to the right. This person is looking straight ahead, but their neck is being pushed over to the side, and on this side we're seeing a pretty straight line with the neck that follows this arrow. Now when we look at this, we've got about 10 to 12 pounds of weight that's being pushed over to the side here. What that does is that puts extreme stress on these joints here, which also triggers headaches that lead to migraines, and so forth. So as chiropractors, what we do is we look at these things and try to determine how we can take the stress off of the neck so there isn't that irritation on the nervous system that then puts that person into a state where they're experiencing a migraine. So next we're going to look at some of the treatments that we use here in the office to correct these conditions. Okay, we can see here that we have Jean. She's in the harness here, and what this is doing is it's cradling the back of her skull, and it's putting a distractive force. This is called Decompression Therapy. It's controlled by this computer back here, which it starts off at a very low pressure, allows the muscles to relax, and then slowly builds up as it goes along. This treatment typically takes somewhere in the order of about 15 to 20 minutes to accomplish, to go through a full treatment. Here we can see we've got Amy in a cervical remodeling collar. What's happening here in this back piece is actually pushing forward. We talked about earlier in the video how sometimes the neck can lose the curve. This is pushing forward to help restore that curve. And what we'll do is we'll actually have her walking on the treadmill with this to help kind of facilitate this process.
I became a patient of Dr. Bingham's about 4 months ago, about 4 months ago, and when I came to Dr. Bingham, I had severe migraines. The frequency of my migraines were 2 or 3 a week, every other week, and Dr. Bingham was able to use a variety of techniques through vitamins and stretching and just the things that he's researched and practiced, and through that I've had a lot of success and relief with my migraines. They've actually been cut 80 or 90%. I probably have one migraine every 2 months, so it's been fantastic. My quality of life has really improved since I became a patient of Dr. Bingham's, and I would highly recommend him to other migraine sufferers.